Okay, we'll keep this on schedule today. Next, we have Kirk Futrell from Cap Trust. He's a financial advisor. Before I continue with his introduction, I do want to remind everybody, if you haven't registered outside these doors, please stop by and see Tina and Sherry and sign your name. We need that to track and ensure how many folks we have attend today. Okay, so Chirk is not Chirk. Kirk joined Cap Trust in 2020 as a financial advisor and relationship manager responsible for researching financial strategies for private wealth clients as they work toward their retirement goals. Prior to joining Cap Trust, Kirk served as a financial advisor for Lakeside Wealth Management, a firm specializing in financial planning, fiduciary and corporate qualified plan consulting, small business services, risk and asset management, and estate tax and life insurance planning since 2002. Prior to joining Lakeside's team, Kirk traded commodities and stock options on the trading floors at the Chicago Board of Trade and Chicago Board Options Exchange for nearly 20 years. I don't know how you fit all this in your life, Kirk. When Kirk is not in the office or with a client, he enjoys being an outdoorsman and cheering on the Kentucky Wildcats. He also mentioned to me right before coming up here that he is a 1991 graduate of University of Kentucky. So please join me in welcoming Kirk.
So I did not add that line about cheering on the Wildcats just for this seminar. That has been in my bio since day one. So I did graduate in 91, and I do not recognize anything on campus. I can drive around campus and I'm lost, and I actually am right next door to where I used to live, which is Holmes Hall, by the way. Okay, 25 documents everybody needs. So another just kind of a brief bit is that Cap Trust are the advisors on the retirement account. Custodians of TIA back here and Fidelity are both present also. Two other great resources if you have any questions about your retirement plan. So the documents that I'm going to go over are documents that we've put together that we feel everyone should very strongly consider. You might not need every one of these, but you need to know that there is a very strong potential need for them in the future for everyone here and your loved ones too. So the first thing I'm going to go over is wills and trusts. Okay, when you think about whether you need a will or a trust, you can think about a will as it's a document that designates who is going to get financial assets that belong to you. A trust is more along the lines of not only who is going to get it, but when are they going to receive it. And we also refer to a trust as control from the grave. So if you have significant financial assets and you would like to distribute them to an individual or an entity, 501c3 for example, over time, a trust can do that. It's an entity that can own things. A will is a legal document that describes who gets the assets. A trust actually owns assets. So I'm going to get into a little bit, we'll go a little bit more in depth on trusts, but there's revocable and irrevocable trusts. So we have will, living trust, durable financial power of attorney that most people do not have and most people need. Medical power of attorney and a living will. So the medical power of attorney is the actual document. A living will is a description of what you would like done should you be incapacitated or dead. And it's going to describe what happens to not only to your body, but what you would receive, whether it be continue to intravenously feed you or hydrate you, or whether you do not want any assistance whatsoever and you just want to pass. Okay, like I said before, a will directs the assets once you die. One of the most important things about a will that people oftentimes they don't know is that it establishes a guardianship for your children. So if you have children that are under the age of majority, so 11, 12, 13 years old, whatever the age may be, and you and your spouse were to die together, hit by the proverbial bus, who would take care of your children? So if people are here to discuss retirement, the guardianship may not be something that applies to you, but think about your children or relatives that have children that are under the age of majority. This might be something that you might need to pass along to them, okay? Directs the assets, and then the executor is named in the will. They are the person that's actually able to distribute the assets. So who writes the check, so to speak? The executor that you name is going to be the person that directs those assets at the appropriate time. A will can also, so a trust can own assets, but a trust doesn't have to own assets. A will can direct the assets into a trust. If you have a trust written up to receive retirement assets, it's really important to have the discussion with the attorney that's preparing your trust, because there's a chance that those assets could become taxable when they transfer to a trust. So there needs to be wording in the trust that says that it can receive retirement assets. Does that make sense? Again, trusts can be either revocable or irrevocable. There are reasons you may or may not want to do either of those. I am not a lawyer. You're going to want to get a trust lawyer that specializes in writing trusts, but the basic difference between those is just like they sound. A revocable trust is controlled by you. The trust can own the assets, but if they're your assets, if you're the grantor that gave the assets to the trust or put the assets in the name of the trust, you can pull them back out should you desire to do that. An irrevocable trust, it gets the assets out of your name and out of your estate. They're gone. They no longer belong to you. They belong strictly to the trust. Distribution of those assets have to be in line with the wording of the trust. Very important to know, too, that when you go into, let's say, for example, Fidelity or your TIA account, which I strongly recommend everybody do, make sure that you have beneficiaries set up in those websites. Okay, tell me again, what's the name of the Hannah? The name of what we discussed before, My UK. So when you go to set up beneficiaries in My UK, those do not spill over to your TIA or Fidelity account. Okay, strongly recommend setting up a username and a password. On those sites, go in and check and make sure that your beneficiaries are who you would like them to be. In addition to that, if that relationship changes, so relationships change for a lot of reasons, okay, whether it's an argument or whether it's a death, it's very, very important to log back in and make sure that your beneficiaries are always updated. Plus, you want to make sure that your investments are appropriate, that you're contributing what you need to contribute in the plan that you want to make sure that you're contributing it. Very important to know that if a trust is the owner of the asset, those assets don't go through probate because the trust is an ongoing entity. You died, the trust didn't die. The trust can be the owner of the assets. So a lot of people of significant wealth might put a house, land that they intend to preserve for future generations in a trust. That way, when you die, the trust continues to operate and those assets continue to be used in the fashion that you mean for them to be used in. And again, a trustee is the person that will be named in the trust that's responsible for carrying out the desires of the trust. Okay, whether that's distribution of assets or anything along those lines. Revocable and irrevocable trust, we went over that, so I'll just keep moving. Letter of instruction it's basically attached to the trust, and it has the names of all interested parties in that. Power of attorney is a document that a lot of people don't have, that a lot of people really need. So if you are incapacitated or out of the country or are unable to act on your own behalf financially, you can establish a power of attorney and have someone act on your behalf financially. You really need to be careful here because they can do anything legally that you can do with your money. So my daughter is my power of attorney. She just doesn't know it. She could sell my house by the time I get back to Chesterton, Indiana. But she is to know that she needs to go to the little brown folder, and everything she needs will be in there. And we'll get to that in a minute too. But when I established my will, my power of attorney, medical directives, and so forth, the attorney gave me a 3-ring binder. I recommend that everybody do that. I didn't know he was going to do that, but there were little sections in there that prompted me to go online to, for example, Verizon is my cell phone carrier. Well, if I die, what happens to my Verizon account? Well, now there's a printout of my Verizon account with my username and password on it. When my kids go to the 3-ring binder, they will see there's my Verizon username and password, my phone number, my PIN, and they can discontinue my cell phone service. That's really important to do with most any gas, electric, your utilities, things like that. Accounts that you have that need to be addressed upon your death, you need to have those organized. And someone needs to know that they are organized, and they need to know where they are located. That's free. That's not part of the presentation, but that's just extra. Medical power of attorney allows someone, so imagine you're incapacitated due to, we'll use a car accident, for example, or a sickness or whatever scenario that you can invent. Someone is going to want to tell the doctor what your wishes are. You need to document, we all need to document what those wishes are, and have the person that you have chosen to be your medical power of attorney, let them know where those are and have that discussion. I also recommend that you have that discussion with anyone that you feel would show up at the hospital and want to contest what the other person was saying. So get everybody on the same page. This is what I want, okay? And then have it legally documented so that it can then be presented to the doctor. I have heard that a medical power of attorney is not enforceable. I do not know this is a fact, but I have heard that it is not enforceable in a court of law. But most doctors will use that and will not listen to anyone else as long as that is documented. Living will lets everyone know what you would like done to your body. And do you want medication? Do you want sustenance? Do you want intravenous drugs? Do you want hydration? How do you want your incapacitated self to be administered to? Financial records. This is kind of what I referred to before. What things do you own? What are your activities? Do you have credit cards? Do you have your cell phone bill? Things like that. Insurance policies, IRAs, annuities, any type of financial accounts that you have at a financial institution, those need to be documented. Your beneficiaries should also know that they are beneficiaries. They can call in and they can describe to a financial institution that you have died, and being the beneficiary, they would then provide a death certificate and identification. That way the financial institution can distribute those assets to that interested party. Other examples are stock certificates. They actually do still have those, although they don't issue them anymore. They're still acknowledged. But savings bonds, if you have a mortgage, what's that information? How does the person get in touch with that mortgage company? Tax returns. You want at least 3 years of tax returns available. If you have loans, titles of assets that you own, get those organized and get them in the right place. Let your beneficiary, let those people know where those are located and what to do with them. A lot of people don't really like to talk about death. I'm strangely comfortable with it. I don't know why, but I think that it's a discussion that everyone needs to have with whomever is going to be responsible for you or those assets should they receive them upon your death. Birth certificate, death certificates, marriage licenses, divorce decrees. These are items that everybody needs to have and have in one place. If you have a QDRO, a qualified domestic relations order, so that's a way to, it's a court document that distributes retirement assets upon divorce. So if you have one of those, you need to hang on to that. If you have child support payments, life insurance papers, all those need to be held in a secure, hopefully fireproof location in case of that type of disaster or flood. Flooding also is a big one. Okay, taking control. If you all don't take much away from this, this is a call to action. So you need to get on this. We don't know. We're not promised tomorrow. I don't know if anybody's ever heard that before. We are not promised tomorrow. I may not make it home from this seminar, but if I don't, all my documents are located exactly where my kids know that they are, and they'll be able to access those and take action. If I did not take action on this, they would be, I cannot imagine them, first of all, they're going to have to deal with my death. I kind of believe that's going to be a sad event in their life, but that's just me. But for a loved one to have to deal with your death is going to be extremely difficult. A lot of you know how difficult that is. You don't want your loved ones to have to go through that and then try to figure out how to get in touch with Verizon to disconnect your cell phone. That would just be, in my opinion, that would just be horrible. Get all those organized and let them know where they are. Don't put off those difficult decisions or those discussions. Most people don't like to talk about their death. It's okay, but do it anyway. Put yourself in an uncomfortable position and do something that needs to be done for your loved ones. That's who you're doing it for. I mean, let's cut to the chase. You're going to be dead. Like, you're not actually going to be around to have to deal with any of this stuff. But don't do that to them, okay? You might need to, on the bottom point, get help based on the complexity of your situation. You may not know the answer, but find it. Like I said, this is a call to action. Take action and get those documents, get these things organized, and have the right discussions. Make sure that they know, make sure that this is what I recommend. Make sure that everybody knows what your decisions are. That way, I mean, one of my worst fears is that I'm going to die, and that's going to cause my two kids to be at odds with each other, and that's going to ruin their relationship. I don't want that. So I have a discussion, or had a discussion with both of them. This is what it's going to look like when I die. When I die, by the way, not if I die, when I die. Nobody gets out of here alive. Revisit the documents from time to time. Things change. You may go through a significant portion of your assets and may just decide that part of your legacy planning is to donate those assets to a charitable organization. That's a change. Before, the kids were getting 50-50, now they're getting 0. I had a discussion with my kids too that, my intention is to bounce my last check to the funeral home. I did it myself. You guys got to do it yourself. That was my discussion with them. I have a lot of private wealth clients that do have a very generous legacy plan, so it's very important to them that their kids they get the first down payment on their house. Once they get married, they get to set up 529s for their children. Things like that is very important to them. That is wonderful. I love it, but you need to do it. And you need to have a discussion with all of those people to know that that's part of your legacy plan, is for them to receive certain assets. Make copies and keep them safe. I mentioned 2 natural disasters, flooding and fire. You can get I have a gun safe, okay? I do. I'm an outdoorsman, like we said, okay? My kids know that if I die, get to the gun safe. Here's the problem. If it floods, that thing's not waterproof. That's a problem I haven't dealt with that I probably should, but make it fireproof, make it floodproof, and have those discussions. I ran through that pretty quickly. I want to save time for questions. Does anybody have any questions to start out? I will be here the next couple of days. I'm in the student center. My appointments are booked, but I do know that I will be back. Well, I'm very certain that I will be back in December. So when you see that CapTrust is coming to town, it's probably going to be Kirk. I would love to meet with as many of you all as would like to meet with me. I will be able to discuss your retirement plan, as well as any other aspects of this presentation or general financial questions. Some people will sit down and say, no, I'm good on that. But what I did want to talk about is talk to me about 529s. What happens if my kids don't go to college? It's a great question I get all the time. When I come around, if you all want to sign up, we can go through any of these financial questions that concern y'all. Wait 1 second. They're going to get you a microphone. I'll be able to hear you better.
If you already have a trust, do you need a will?
You do not.
Okay.
As long as your trust designates you need to revisit it. Make sure that everything in there is still relevant to what you want to happen.
Okay.
You can have a will if your trust doesn't own those assets. So most times we'll have a trust and then you title your assets in the trust. So if you go online, like to the county recorder, and you can actually see your house and you can see that you own your house. If you title that house in the name of your trust, it's going to have the name of the trust as the owner of the property. In other words, you don't own the trust anymore. You don't own the house anymore. The trust owns the house. You're the executor of the trust, so you can pull things out of the trust if it's revocable, or some people say revocable, but you can pull things out of the trust anytime you want to because you control the trust, because it's revocable.
Thank you.
You're welcome. Question over here. I can send it. I have my cards are back there on the desk I was sitting at. If you would like to grab one of my cards and just contact me via email, I can send you this presentation if you would like. I think, Hannah, do you have the presentation? Are you making the presentation available to everyone, or Coleman?
They can contact our office and we can provide that.
There you go. Contact the office or grab my card and email me, and I'm happy to provide it to you.
Yeah, it's been, and since then, more things have occurred. Can you set that upon death, assets will move to the trust?
Springing trust. It's a particular type. There's a lot of different kinds of trusts. What you're referring to is called a springing trust. So you can have a trust that doesn't own anything until an event occurs. And death is the primary event that would spring that trust, and then they would then own it. And that bypasses probate. So upon your death, the trust immediately owns it. So if a creditor, for example, were to come in and say, Kirk Futrell owes us $20,000, well, Kirk Futrell has zero in his estate. The Kirk Futrell Trust owns it. Kirk doesn't own anything. anymore. So that would be a springing trust, and those are very effective. Last chance. There we go. Right
I just found out that Kentucky is one of the states that has inheritance tax. So by using a trust, can the beneficiaries avoid inheritance tax?
I believe so. I believe so. Yeah, I would talk to an attorney, but that's the way that I understand it, yes. Because the trust owns it. You're the one that died. The trust is an ongoing entity, so nothing occurred in the trust. Thank you all for having me. Again, Tia is here, and so is Fidelity. So those are two other resources, CapTrust, Tia, and Fidelity, that can all provide information on your retirement account.
All right. Okay, thank you so much. I want to remind folks too that in addition to Tia and Fidelity, we have people from our temporary employment office. If you're interested in looking into coming back and working in a temporary role after you retire, those folks are back there. We have Know Your RX, we have MPM voluntary benefits, we have health and wellness. I know I'm going to miss somebody. We have our benefits table. We have technology services to talk to you about the technology that you'll have access to once you retire. Who did I forget? Raise your hand if I forgot anybody. All right. Well, we're going to go ahead and move along. And I left my notes down here. So we're going to move along and start with the health presentation a little bit earlier. Thank you, Hannah. We have Terry Knatzer. She's one of our retirement specialists with the HR benefits team. She's been at the university for 26 years. She provides personalized retirement sessions to employees with one-on-one appointments. Many of you may have already met with her. She, along with Juliet Souders and Coleman Simpson, will provide those. She helps employees understand their options for retiring and all benefits available to them. And then we have Melanie Rudy, who's the Senior Client Service Manager with United Healthcare, and that's the vendor I forgot to mention, United Healthcare. She has over 10 years experience in insurance and managed care. Melanie is responsible for managing the overall service experience for group retiree clients. Her primary focus is supporting the day-to-day relationship with the client to ensure customer satisfaction, and is also the liaison between the client and all internal business channels. They are going to talk to you today about the transition and the health benefits in retirement. So, welcome.
Well, hello, everyone. First off, I just wanted to let everybody know we will send out a follow-up email for those that registered with all the PowerPoint slides. So you don't have to email us. We will send those out to you shortly before the end of the week. I'm going to get us started. Melanie and I are going to go over with you planning to retirement and understanding the retiree health benefits. So starting with what everybody receives from UK, a lot of these are free to you now as employees, and they carry you to when you retire. Starting with financial planning with CapTrust and Enrich. CapTrust, and you've met one of the representatives with CapTrust. They are an independent advisory group, and so they can go over your investments with Fidelity and TIAA, but they can also look at any other retirement accounts that you may have outside of the UK plans, and also if you have any financial priorities that you're trying to get ahead of, like with money management, budgeting, You can lean on them for that advice. And then also Enrich, they give financial advice, but they're more of an online resource tool. If you go to our financial well-being site, you'll find a lot of resources and handouts and just information to help you better budget your monies. And then Retirement Account of You with Fidelity and TIAA. Hopefully you've met our representatives. They're here today with both carriers, and we want you to have a relationship with them, meet with them annually, especially if you're nearing retirement. Really, you should be having ongoing meetings with them just to get ahead of your investments, make sure you're on track, get advice. And when you retire, how are you going to start withdrawing those monies? So that's things that they can cover with you as well. Know Your RX Pharmacy, they're a vendor here today. We have pharmacists and benefits that can advocate for you, making sure you're getting the lowest price for the medicines that you might be taking. I think they're one of our best kept secrets. A lot of people don't realize that there are some prescriptions out there that have coupons with them that can help lower your prescription cost, and a general consumer may not be able to find those coupons. So lean out to them, reach out to them for support. We have the Elder Care Program where you can talk to a specialist in aging that knows the aging resources nationally. So if you're taking care of an aging parent or loved one, they know those resources and can provide you with that support you need. Mental health therapists through the Work Plus Life Connections program, you can receive up to 5 free counseling sessions every physical year. So if you've used your 5 within this year, it'll reload next year, physical year. And that's for you and also your family members. We have dietitians with the Health and Wellness program. If you want a one-on-one consult just to look over your nutrition and help you better with your health. And they also run a lot of weight loss type management programs. And there's a whole lot more on our health and well-being site, such as health coaching, helping you set up goals and helping you achieve them. And the goals can range anywhere from getting better sleep, managing better relationships, you name it. There's just so much more out there on our well-being site. And also elder care, Work Plus Life Connections, wellness, work life. They offer support groups on a variety of topics and presentations throughout the year. Next, getting into fun opportunities, fitness membership through MoveWell. Now, when you retire, there's one particular gym I'll highlight, which is off Export Street, because you can easily get to it and park pretty easily. But an employee type gym you'd have access to would have very low, it's not as busy as other gyms, and their rates that they charge you is very inexpensive. And then just a whole lot of more wellness opportunities that you can take advantage of. Every year in the fall, we host the benefits office hosts a retiree fair, and it's a really great way to check in with your vendors, ask them specific questions. And we also have flu shots available if you're interested in that at this annual event. But we also invite other community type programs that can help you learn about volunteer opportunities, enrichment programs that you can take advantage of. Activities and more through the Osher Lifelong Learning Institute. Something must have happened. They should have been here today, but I think they just couldn't make it. But this program is so popular. These are programs not on at UK, but some are, but most are out in the community. A lot of social, recreational events, programs, enrichment opportunities, and you only have to be 50 years old. So if you're 50 years old, you could start taking advantage of what they're offering. And then tuition-free courses through the Donovan Scholars Program if you are 65. What's your official years of service? Well, if you're wondering what your official years of service is, and you're trying to find out what your health insurance might cost you in retirement, the best way to get an accurate understanding of all that could be offered to you is just by contacting us in the retirement office. And the best way is our retirement@uky.edu email, because that goes to All three of the retirement officers, it's shared by myself, Juliet Souders, hopefully you met her today, and Coleman Simpson. And one of us will get with you and send you a service check, a letter telling you what's available to you. And if you wanted to also set up a meeting with us that way, we can certainly get an appointment set up. Now let's talk about early retirement versus normal retirement. What does this all mean? Well, early retirement and what UK is defined as meeting that criteria is if you're less than 65 years old, you have to meet two criteria. First, your age plus years of service have to equal 75. Plus, also, you have to have 15 consecutive years of service. Staff are encouraged to give a 90 calendar day notice. Normal retirement is 65. Regardless of your years of service, you're 65, you qualify to retire from UK. Staff are encouraged to give a 30 calendar day notice. If we have faculty in the room, faculty are asked to give a semester's notice, especially if you're teaching faculty. Now, the bullet on phased retirement here, this is something that could be considered prior to retirement. I think of it as a way of easing into retirement. You do have to meet certain criteria for this, one being you have to be at least 60 of age and have 15 consecutive years of service. And you can only be on a phased agreement up to 3 years. More about phased retirement, besides meeting that criteria, and like I said, you can only be on a phased agreement up to 3 years. You're going to reduce your full-time status and salary. So the position has to be no less than half-time, but no more than 80%. Your salary will be proportionate to that FTE. You get the same health benefits as you have even if you go to halftime. So there's no impact on your health benefits. You also still get the 200% employer match continues for your matching plan. And a difference with phased retirement that you wouldn't have as an active employee is that you can fully access your retirement monies with TIAA and Fidelity. So that would be an exception. And if you need to supplement your income, that's how you could do that. This last bullet here I think is very important. Your department, not HR, grants phased retirement. So in our opinion, the first step we think is to have a conversation with your department to see if your unit does support phased retirements and your position is suitable for a phased retirement agreement. If the answer is yes, start having the negotiations in terms of your workload, your FTE. You can reach out to benefits to get the agreement. It is on our website, but you can get it online. And of course, we can help you in retirement get all the approvals that you need to start that agreement. Another thing not noted on here, but I think it's important to note, is just make sure that you start this process early. It's something that you should be requesting with your department 90 calendar days before it starts. Some additional details on early retirement that I wanted to point out. We already talked about the rule, meeting the rule of 75, having 15 consecutive years of service. But when we're calculating your years of service in retirement, it's based on your FTE. So if you are in a 0.75 FTE, you're going to have to work longer to get your 15 consecutive years. For example, 15 years working in a position at 100% is equivalent to 20 years classified at 75%. And your years of service has to be continuous with no breaks in employment. And those years, what we count are your regular positions, not temporary or on-call positions would not count towards retirement years of service. Normal retirement is when, like I said earlier, you're 65, you qualify just by turning 65. But to have access to the health benefits, you do have to have 5 consecutive years of service. And to get the health subsidy, you have to have 15 consecutive years in 100% FTE status, but your hire date also has to be prior to January 1st of 2006. Those years have to be continuous and in a regular position, again, not temporary assignments. So what we do as retirement specialists when we're doing your service check and looking at where you fall with insurance, the cost depends on several factors. One, your date of hire, because if you were hired after 2006, fortunately you don't get the health subsidy, but would have access to the health benefits. We're looking at your years of service, the date and the age that you're retiring, and whether or not you are returning to work and through steps or in a post-retirement position. Everybody here today should have a copy of a retirement benefits booklet. And if you're joining us virtually online, you can get this on the benefits website. There's a retiree section. We always post the most current physical year retiree benefits rates and any updates. You'll find a nice user-friendly copy of that online. We're not going to get too detailed here in this presentation on the cost, but real briefly, dental insurance, you'll have access to dental insurance. It is the same carriers. You have the choice between UK Dental and Delta Dental. If it's UK Dental, I do want to point out in your retiree benefits booklet, they're different plans and the costs are different. But if it's Delta Dental insurance you have, it's the same cost, same plan that you would have as an employee. Vision insurance through iMed, if that's important to you, it's the same cost, the same plan options that you would have offered to you when you retire. Summary of the health insurance plans to consider: if you are under the age of 65, you're looking at the same health insurance plans available to you. It's just the cost is going to differ based on your hire date and when you're eligible to retire. And the retiree group rate is different from the employee group rate that's offered. Now, when you're 65 and older, this is when you would have to look at Medicare Advantage plan being an option for you. And we'll get in, Melanie is going to get in more to that in her presentation. And then if you are returning to work through steps or in a post-retirement position, then you can get reduced cost of insurance. Now this slide is just showing you the percentage of medical premiums that a retiree would pay if they were hired before January 1st of 2006. So that's where probably most of our folks fall in this age service matrix, unless you were hired after 2006. So if you fall into this category, this chart just shows you basically what the percentage of cost you'd be paying. So someone that's very on the younger side, less than 60 years of age, and has 25 years of service, they're going to pay 40% of the cost of the retiree group plan. But if that person delayed retirement and they waited until 63, then they're only paying 20% of the cost of that insurance. And this is only until you're 65, because at 65, you're not working. You have to transition to Medicare and have a Medicare plan to fill in those gaps, and you could have our Medicare Advantage plan offered through United Healthcare. I should also say on that back slide, you do get locked in at that age at retirement until 65, so it does not lower as you have another birthday, so do keep that in mind. Now, some people retire and then they go back and work through their department, or they find a steps position. And if you are returning to work and working 20% or more of an FTE, that's equivalent to 8 hours a week, and you come back 3 months prior to retire or after your retirement date, it's the same employee insurance rates. But if it's after 3 months, it's a reduced rate for retirees and dependents as long as you were hired prior to January 1st of 2006. And then if you're 65 or older, then you're looking at the employee medical plan that you have now, the HMO, PPO as an option. Some important contacts that we have in benefits. We want you to know that we have a customer service line that you're welcome to call Monday through Friday between the hours of 8 and 5. and you could always speak to someone. Our customer service team has a lot of information already at their fingertips, but if they need to send the call to one of us in retirement, they'll help get us in contact with you. Also, like I said earlier, retirement specialists, there's 3 of us, myself, Juliet Souders, and Coleman Simpson. We share this retirement email. So the best way to get in touch with us is that way. Or you can contact us individually if you prefer. We would retire you from the university, get all your benefits set up if you do enroll in our benefits. And then we have a retiree benefits administrator by the name of Joshua Baber. He is a ongoing point of contact of any changes in your retiree plans after you've retired. And then if you ever have medical claim issues, concerns, we have a benefits advocate, and her name is Debbie Martin. Okay, we are going to open it up for question and answers in a few minutes, but I'm going to now pass it over to Melanie.
Thank you. How do I use the clicker? I'm pushing. One second. There we go. All right, so I'm going to talk to you all about the Group Medicare Advantage plan that is available to you once you retire. So I know we've talked a lot about Medicare, some of the other speakers have, but I will just go over some original Medicare basics, some of the plan benefits and programs available, and then we'll do Q&A. So when are you eligible for Medicare? So when you turn 65 years old or you have a qualifying disability or special situation, and if you are a U.S. citizen who has resided in the United States for at least 5 consecutive years. And then if you or your spouse have contributed payroll taxes to Medicare throughout your working life, you're eligible for Medicare when you reach age 65, regardless of your income or health status. Understanding your Medicare choices. I know this was mentioned previously, but under Original Medicare, it covers Part A, which is your hospital and inpatient care, as well as Part B, which is going to be the outpatient care. And when you enroll in Original Medicare, you can choose to enroll in additional Medicare coverage, such as the Medicare Advantage plan, which is shown here. And under the Medicare Advantage plan, it is known as Part C. So this combines A and B and typically includes Part D as well. And it also provides additional benefits that I will go over, services and programs that you can't get under Original Medicare. Some of the Original Medicare rules that I would like to point out, as I had mentioned, you must be entitled to Medicare Part A and or enrolled in Medicare Part B and continue to pay your Part B premium. If you stop paying your Part B premium and you're enrolled in the Medicare Advantage plan, you will get disenrolled. Medicare will disenroll you from that plan. And you can only have one Medicare Advantage plan at a time. So if you enroll in the UK Medicare Advantage plan, you can't go out and get another Medicare Advantage plan. And if you do not enroll in Medicare Part D prescription along with the Medicare Advantage plan, you may end up having what is called a late enrollment penalty. So just to reiterate, Medicare allows you to enroll in one Medicare Advantage plan, and you also have to have a prescription drug coverage plan. Both must be group sponsored. So now we'll take a look at some of the specific plan benefits that are available under the UK Group Medicare Advantage plan. Again, just to reiterate, this is Part C, which includes the Part A, B, everything original Medicare covers, plus some additional benefits. So I know I had a lot of questions about providers at my table. So this is known as a national PPO plan. You can go anywhere in the United States. You also have in and out of network benefits under this plan. You do not have to stick with an in-network provider. It's the same cost share under this plan. Some of the providers that you currently use might already be in our network, and you can look on the website listed there. It's retiree.uhc.com/UKY. Or you can always call our customer service just to see if your provider is in network. Taking a look at some of the benefits and cost shares. So this is the current 2024 and 2025 benefits. We don't know the future yet, but there's typically not much variety. This has been pretty consistent. So there is a $185 deductible with a $3,000 out-of-pocket maximum for office visits, specialist visits, inpatient hospitalization, and outpatient surgery. They all have a 4% coinsurance, and you can see it's the same for in or out of network. There's the urgent care copay, $45, and emergency room at $100. We also offer Medicare virtual visits. You can just hop on your tablet, phone, and those are a $0 copay. Some of the preventative services that are covered under the plan are the annual physical, annual wellness visit, and your screening, such as breast cancer screening and colon cancer screening. All the preventative services have a $0 copay. Some additional benefits are going to be the Medicare covered podiatry, chiropractic care, vision services, so routine eye exam, hearing exam, as well as acupuncture. Acupuncture has been a new one in the last couple years that Medicare has added. And all of those have a 4% coinsurance and in and out of network. So I wanted to highlight some of the additional programs. I like to call them the advantage of the Medicare Advantage is some of our programs that we have available. And I believe I have a flyer on most of these at my table. So if you want more information, go ahead and grab those. But one of our programs is the House Calls. And this is a yearly in-home visit from one of our licensed healthcare practitioners at no cost to you. They come into your home, they do a thorough exam, health screening, they discuss medications, and then you can ask questions. Then they send a summary to your primary care provider. They also now offer video visits, but again, this is no cost under this plan. Renew Active is another highlight. It's a gold standard in Medicare fitness program at no cost under this plan. It's a free gym membership, and it has access to a nationwide network of fitness centers. You can go to multiple. You can go to 5 different network or gyms. You don't have to stick with one. And again, this is no cost to you. There's also the 24/7 provider support. You can, if you have a question, you can't get into your provider, you can call, you can do a video chat as well and discuss any questions you might have. They can diagnose and prescribe medication. Another program that is available under the UK Medicare Advantage plan is our discount program. This one is, it's a website listed there that offers a wide variety of discounts on different essentials such as travel, home services, meal delivery. One that I know off the top of my head are some of those meal delivery programs like HelloFresh. That's one I can think of. But you can get different discounts on these services. You just hop on and search for which program you're looking for. Another program is our United Healthcare Healthy at Home. This is available to you if you're eligible following benefits up to 30 days after inpatient and skilled nursing facility discharge. So if you're in the hospital in a skilled nursing facility and you get discharged home, you have 30 days to call and you will get 28 home delivered meals, 12 one-way rides to medically related appointments, as well as 6 hours of non-medical personal care in your home. And this is after each discharge. So if you happen to go in the hospital multiple times in the year, you can use this benefit after each discharge. And I believe this is the last slide for me, but another benefit that is not available under original Medicare is the hearing aid benefit. So you work with our United Healthcare Hearing Network. They will get you access to setting up a hearing exam, and then you can select from prescription and non-prescription hearing aids at a significant savings. All right, we will open it up for questions.
So,
Yeah, sorry. I just want to introduce myself real quick. I am Coleman Simpson. I'm one of the retirement officers, so I'm going to be answering on the previous presentation, and then of course Melanie will still be here to answer the questions on the UHC slide. So, what's your first question?
yeah, the signed up for Medicare Advantage, UK Medicare Advantage as a retiree. So you still need to sign up for Medicare B, right? And the payment is subtracted from your Social Security check, all right? And then you pay additional $19. How? You don't get UK paycheck anymore. So you just have to write a check to UK.
Yeah,
Yeah.
so the way that it works is that for Medicare Part A and Part B, now again, as Russ Russell earlier mentioned, Medicare Part A is generally free. Medicare Part B has a premium. That is deducted from your Social Security check, just like you mentioned. The Medicare Advantage premiums, those are deducted from your bank account. So there is two different withdrawals there. One directly from your Social Security check for Medicare Part B, and then one for the Medicare Advantage plan, which comes directly out of your bank account.
Okay, so now I will get a Medicare Advantage card. So
Correct.
if I go to see my annual checkup,
Mhm.
I just need to bring that Medicare.
That's correct.
I don't need to have a separate Medicare A and B card.
Now, I would highly recommend that you hang on to that Medicare A and B
Both?
card because Medicare will use that from time to time. But whenever you're going to see a provider, yes, you can just provide the Medicare Advantage card. You shouldn't need to provide your Medicare card.
So basically, I'm confirm the Advantage card
Ye-
already.
Effectively, yes.
Yeah,
So
A,
basically,
B, and
Medicare has it linked on their back end where they can see that you're enrolled in our plan. So once you hand over the Medicare Advantage plan, it's all linked on the back end.
About the working retirees, on the website, it says that the rates are for HMO $45 for a retiree. Does that matter if it's a early retiree, like before 65? And does it matter if does it
Yeah.
incrementally increase with what percentage FTE you are?
Yeah, so here's the way that it works. Now, that is again for the working retirees, and the working retiree rate is for employees who were hired prior to 1/1/2006 and have at least 15 years of service at their retirement, or for employees who retire and come back to work within 3 months of their retirement for that first year. Now, the way that that works is essentially, yes, you pay the employee rate for the employee-only coverage. UK does not cover any percentage of the health insurance premiums for a spouse or any dependent children on there. So the rates for, employee plus spouse are a little bit higher than maybe you would have paid, as an employee. But yes, you would pay the 45. Now that is if you're working at least 0.2 FTE all the way up to 0.74 FTE. If you're working above 0.75 FTE or above, then you receive the full credit for both you and for any dependents on there, because you're effectively considered a full-time employee through the ACA. Does that make sense? Anyone else?
Yes. Oops, sorry. So my question is kind of related to that. If you do the phased retirement, I know as an employee you still get the same benefits, but what about dependents, like a spouse?
Yeah, so while you are on phased retirement, you are effectively considered a full-time employee as far as your benefits goes. The only exceptions are, of course, your salary, right? Your salary decreases based on your FTE, which means your retirement goes down, your retirement contributions go down based on that. And then, of course, TDL time, vacation time, if you're a staff member, also go down. But as far as everything else, you're still considered a full-time employee. So you would still pay the full-time employee rate for your health insurance. So if you're paying, $400 a month for you and your family on the HMO now, you're still going to be paying that and while on phased retirement.
Sorry, so is Medicare Part D part of the Medicare Part C Advantage plan?
That's correct. Medicare, the Medicare Advantage plan is bundled in with Medicare Part D. So if you have our Medicare Advantage plan, you are still getting Medicare Part D through us. Now, as Russell mentioned earlier, depending on your modified adjusted gross income, you may potentially pay a little bit more. Again, if you're filing, I believe it's over 106 jointly, 106 individual, 206 jointly. Then you may pay a little bit more for Medicare Part D through Social Security, but that's going to be a Social Security rule. But to answer your question, yes, Medicare Part D is automatically included in the UK Medicare Advantage plan. Other Medicare Advantage plans outside of UK may or may not have Part D included with it as well. Okay. Any other questions? Anyone else? Okay. Well, thank you all so much for coming today. That concludes the end of this conference this year. Grab you some breakfast on your way out, and if you have any questions, all of our vendors are still here and will be in the back if you have any questions directly for us. Thank you all very much for attending, and have a great day.